Hello, healthy women. I want to talk to you about knowing yourself, knowing your type of vaginal discharge. Every woman is supposed to have vaginal discharge, but I noticed some of my patients in my consulting room as a gynecologist coming to complain about normal discharge. A woman should have a normal discharge according to the menstrual flow. We have our menstrual flow coming every month, and immediately you complete your menses, you are supposed to have a clear discharge. The discharge will not be itchy and it will not have an offensive smell. Subsequently, like 3 or 4 days to the time of ovulation, you will start having slimy mucus, as if you have a runny nose. That slimy mucus will run for like a week from the onset, or 3 days for short, and then it will change to a sticky whitish type of mucus. So those sticky whitish type of mucus is what you will see until another menses starts again. So a normal discharge shouldn't be itchy, and it shouldn't have a abnormal color like green or red. So a normal discharge will have whitish color. Sometimes when hair blow on it, you have light yellow color. And these are the discharges that stains the women's panties. And of course, as you take care of your hygiene, make sure you clean yourself properly. You don't let yourself be wet all the time. And then this will prevent you having what we call yeast infection. Sometimes you also hear our patients complain about whitish, itchy, cord-like discharge. So when you have such, then you may have a yeast infection, and this will need treatment. Sometimes we also have discharges that are greenish in color. When they are greenish in color, this is not a good sign. And it also has its own type of organism that is causing that, and that's we need treatment in the hospital. Sometimes we have yellowish, frothy discharge. So you see this discharge has some bubbles in them. That's why we said it's frothy. So these bubbles may indicate a trichomonas infection. And this trichomonas infection means you will also need treatment with a cream or a vaginal tablet that will clear off such organisms. And please, my LD women, remember that after you have treated for this infection, you should know that that infection is gone. Don't come telling me in my clinic that I treat it every week. Some women will tell us they treat it every day, which is not normal. So after treatment, adequate treatment, because some yeast infection you may need to treat for 12 to 14 days, not the usual 6 days. That when you buy the clotrimazole tablet, you see 6 tablets there, and then you just treat for 6 days. Some may need a prolonged treatment of 12 days. And during treatment, you need to avoid sexual intercourse. So I want my women to be healthy, so you can have a good relationship with your partners, and you will not quarrel with your partner when there's any issue of vaginal discharge or infection. So please, let's remember, take home message, that we as women have natural discharges that are clear, whitish or slightly yellow, that is not itchy and is not offensive. And this goes on round your menstrual period before menses comes and goes. So don't say I have discharge. Tell me what kind of discharge you have. The color, is it itchy, is it troublesome? Itchy discharge that is troublesome, you won't be able to sit down, you won't be able to go for your regular daily activities, and that will require treatment. But there are some mild irritations that doesn't really need much, that you may still cope with, and you have to be careful not to over-treat yourself, because over-treatment will change the vaginal flora and will lead to other organisms coming in uninvited to cause more trouble for you. So let's stay healthy, keep on watching my blog, and have a nice day.